Good morning, everybody. Happy Monday. This is the Anchorage Emergency Operations Center update for the 5th of April, 2021. All right, folks, driving the decline. Luke, can we get a situation update, please?
Good morning. This is Luke Orrit, Situation Unit Leader here in the EOC. Statewide, up 427 cases, no new deaths, and 4 hospitalizations. And locally, up 185 cases, no new deaths, and 3 hospitalizations. For 213 resource requests, we've filled or otherwise satisfied 1,727, an additional 7 since the last report, with 11 currently open and working. We had 54 non-critical transports in the last 72 hours, with 1 after hours in the last 24. And in the congregate sheltering sites, we have 400 clients, a decrease of 12 since the last report. 344 clients in non-congregate shelters, up 3. It's a total of 744 clients in all shelters, down 9, averaging 2,232 meals served per day. Over the weekend, we had 1,255 sample collections performed at the Visit Healthcare testing sites, averaging 57 per hour. And in the last 7 days, 6,236 sample collections performed. And for our cumulative vaccine numbers, with a total of 46,467 doses to date administered, with 4,112 since the last report. And the site-by-site breakdown is on the slides if you need that. And report.
Moving along, weather.
Good morning, everyone. It's Michael Cutts with the National Weather Service out at Sand Lake. Looking at an overall pretty nice week, except for 2 little factors. A little ripple of energy coming through for Wednesday night. Thursday might bring us a little bit of snow. And unfortunately, Mother Nature is turning the thermostat down on us through the end of the week. Breezy on the west side of Anchorage for Thursday and Friday on top of the cold temperatures. And that concludes my briefing. Or any questions?
Operations.
Good morning, everybody. Rick Meredith with the Operations Section Chief. Brief. You'll notice our Q&I location has 15 projected discharges through Wednesday and 3 today. Our Warmington over the last 24-hour period had 81 people going through it. And you'll notice if you look at the dashboard, the mass care shelters are trending down currently, which traditionally happens at the beginning of each month. But based on the weather, as it's looking toward the end of the week, we are prepared to assume if we get a surge coming back in. In our public health branch, the good news is we've had a testing increase of 3.25 over the past week. While the positivity rate still says 3.23, we want to drive that as far down as we can. Usually when our numbers go up on testing, the positivity rate goes down, and the date was of 4/1. So I think on the next external brief, we'll get some push downward on that positivity rate. For our pop-up testing, on the 5th at K Street, on the 8th at UAA Wendy Williamson parking lot, and on the 10th at Mountain View Elementary School. In our medical countermeasures, the big trend we have right now is we are encouraging everybody to continue to go get vaccinated. We have switched from just kind of a set drive-through appointment walk-in sites. We are trying to go to a hybrid where we've got walk-ins at just about all of the sites we have right now. We have a new site at the Diamond Center that will start that started on the 1st. And walk-ins are accepted. We are setting up a site at the Northway Mall. We're hoping that is active on the 12th, and there'll be appointments and drive-ups. And we've started at Shiloh Church with walk-ins. We've had good uptake. But again, we have low acceptance rates in our appointment system, so we keep encouraging people to go out and get vaccines. Fairweather started walk-ins, and there's a new Johnson & Johnson allocation coming out. Well, half of that will go to the Alaska Airlines Center, and the other half will go to an event at the Hotel Captain Cook on the 18th. And we're looking at starting a pop-up clinic on the Alaska Club West on the 6th. And for our external kind of partnering, we're working with clinics with Local 341 in Tote Maritime and continuing with homebound vaccinations. Pending your questions, that concludes my brief. Thank you.
Moving on, logistics.
Hey, good morning, all. It's Scott Carpenter, the EOC Logistics Section Chief. On our slide today, you'll see that we continue to support medical countermeasures with their vaccine sites. And I've added snow removal where necessary. We'll be out there hopefully getting the Northway Mall area cleaned up and ready to support that 4/12 start date. For mass care, we are working into their summer support requirements. And then for the overall EOC support, we've got some translation services that we're working on with the PIO office, as well as completing the staffing request for EOC personnel. Pending any question that includes logistics.
Finance.
Good morning. This is Carrie Wiedeker, the EOC Finance Section Chief reporting. Today, we have currently encumbered $21,818,872. Our actual spent to date is $43,572,077 for a total of $65,390,949. Please continue submitting invoices and supporting documentation to eocinvoices@anchorageak.gov. The Office of Emergency Management does continue to seek cost recovery in the form of FEMA public assistance. If you have questions about that, contact aaron.zachary@anchorageak.gov. End report.
Safety.
Good morning. This is Annalisa Roberts reporting out for safety. April 1st started this Stress Awareness Month, as well as Distracted Driving Safety Awareness Month. So we've been talking about stress awareness, not just in April, but for the last couple of months. Not every piece of information that safety disseminates is useful to everybody. So hopefully there's something in these slides moving forward that helps people manage their stress among themselves and their family members. So on this slide is 3 stressful facts you need to know and why Stress Awareness Month is so important. So first, the facts are stress can help sometimes. Stress can motivate people to prepare or perform and might even be life-saving in some situations. It's sickening, literally. People who are under stress, especially chronic stress, are susceptible to a variety of ailments, including headaches, insomnia, high blood pressure, and heart disease. And a survey conducted by American Psychological Association found that 5 factors most often cited as sources of stress were money, work, family, economic outlook, and relationships. Obviously, on off years, elections can be stressful. During the pandemic, can be stressful. People, if you've got a sick family member, that's stressful. So these are just the top 5 reasons, but everybody handles stress differently. And then why it's important. It reminds us to pay attention to our health, and it's going strong. The Stress Awareness Month has started since 1992, and because we all feel it. We all feel stressed at one point or another. And there was a recent study shows that about 2/3 of U.S. workers report engaging behaviors such as drinking and crying regularly in order to deal with stress. So if we can just help find healthy outlets for stress management, that's all we're trying to do. So take care of yourselves and others. End report.
Public information.
Hey, good morning, everybody. Cale Casey here reporting out for the Public Information Officers. Over the weekend, we were able to test a theory and use a recent photograph of a grandmother and grandson meeting for the first time post-vaccination. It got a lot of shares and engagement, so we're going to keep with that strategy. We also promoted the ASD clinics that have a heavy appointment schedule this week available, and the Diamond Center, which starts today. That post for the Diamond Center is being boosted by Northwest Strategies to reach the zip codes with diverse demographics around the Diamond Center area. Information Officer Rupp is working with Visit Healthcare on outreach messaging strategies for their clinics. We're also coordinating with Northwest again on more and different ads than just social media. PIO Orono is working with Beans Cafe regarding the Sullivan Arena tours for David Bronson on April 7th and Senator Murkowski April 8th. Our outreach email went out again this morning, and it did include the information from Conquer COVID AK, which has a website with a page for the Alaska Club information all on it. I'll drop that link in here after I'm done reporting. And we're also putting in a 213-hour to fund events in the Muni at Northway Mall that feature opportunities to bring underserved communities out to learn about the vaccine, participate and win prizes, experience a multi-generational event with the goal of education, overcoming hesitancy, and ultimately getting vaccinated. End report for PIOs.
Liaison.
Good morning. This is Celeste Prescott, Liaison Officer for the Anchorage Emergency Operations Center. I'd like to thank all of our partners who are able to join us today. And we do have one that requested to report out, and that's the Chief Executive Officer with the Food Bank of Alaska, Jim Baldwin. Go ahead.
Good morning. This is Jim Baldwin with the Food Bank of Alaska. The Food Bank of Alaska is planning to shut down our Takatnu food box distributions by May 31. We will begin sending out information flyers to everybody visiting that site and referring them back to pantries in the community as well as mobile food pantries. We have begun remodeling of our new warehouse located at 2192 Viking Drive. We are excited about that, and we hope to have that fully operational in our new facility by August 1st. End of report.
Is Kirsten on with Alaska Native Medical Center?
Good morning, this is Kirsten Cole with the Alaska Native Medical Center. This morning we have 5 positives. One of those is in the ICU, and we have 4 PUIs. No patients on ventilators. End of report.
Thank you, Kirsten. And I believe we have Sean on for Alaska Regional Hospital.
Good morning. Alaska Regional Hospital currently has 6 COVID positive patients, 5 of whom are actively in isolation, 2 in the ICU, both of whom are on vents, 4 PUIs.
Thank you, Sean. And is Michael on for Providence Alaska Medical Center?
Yes, good morning. We have 12 positive COVID patients this morning, 4 in the ICU, 3 on ventilation, and 5 who have recovered but are still inpatients.
Thank you, Michael. And do we have anyone on for the 673rd Medical Group?
Hi there, this is Captain Dahmer. Nothing significant to report, sorry.
Thank you, Captain. And Matsu Regional was not able to join us today, but they are reporting out 13 positive cases, 7 in the ICU, 3 on ventilators, and 0 persons under investigation. They also are reporting that they have reactivated their full hospital incident command as of Friday due to an increase in case numbers. And you can see there on the slide where I changed the decompression and staff recall has been reactivated. And that's the end of report for Liaison. Thank you.
Thanks, Celeste. Anchorage Health Department.
Thank you. This is Janet Johnston, epidemiologist with the Health Department. The overall Anchorage COVID-19 risk level stays in the high risk for this week. We've again seen increases in the daily new case counts and the reproductive number, and also the percent positivity. So as of Friday, the 14-day average for new cases per 100,000 was 24.13. This is a 25% increase over the week before, and we've been seeing a steady increase over the past week or so. The reported daily hospitalizations last week ranged between 11 and 20, and the number of available ICU beds during the week ranged between 6 and 16. On average, 19% of the staffed adult ICU beds were available last week. The infection rate, the R0 that we talk about, has increased slightly to just above 1.1. Again, this means that for each new confirmed case, we expect a little more than 1 new cases. So basically for every 10 new cases, we would expect 11 new cases to be generated from that. As mentioned, the total tests last week were similar to the week before, and it sounds like they're now starting to increase, which is good. We hit a high in percent positivity looking at the 7-day average. So a week ago, we hit a high of 3.5, and we are remaining above 3%, but hopefully coming down a little bit from there. In terms of vaccinations, we have the equivalent of 35% of the Anchorage population who's gotten a first dose, and 25% for whom the series is complete. And if there aren't any questions, that's the end of my report.
Thank you, Dr. Johnston. And Bob, Incident Command.
Good morning, all. Hope you had a nice weekend. On behalf of the municipality of Anchorage, I want to thank each and every one of you on what you're doing as we need to overcome COVID and for your efforts to do so. Looking at the percentage Dr. Johnston just mentioned and putting that in numbers, it means at least 101,000 Anchorage residents have gotten at least 1 vaccination as recorded on the State of Alaska website of State of Alaska, IHS, and federal pharmacy lots that have gone into arms. That is over just a little over 100 days, 100,000 shots. I think it speaks tributes to the combined efforts of what we can do together to overcome COVID. That's almost 1,000 shots per day. Thank you for all you're doing, and let's go ahead and try to get back on to pushing a decline rather than struggling to stay even. End of report. Thanks.
Thank you, Bob. Any questions out there this morning?
Yeah, this is Brendan. I was curious how congregate settings, people calling in to sign up for those, how that's going.
Yeah, Brendan, this is Rick Meredith, the operations section. It's going pretty well. I can't say we have any issues. We've gone everything from homebound folks to working with some of the unions and some of the other organizations, as well as in our congregate and non-congregate shelters. So we're doing good on it.
Our next briefing will be at 10 a.m. on the 8th. And everybody have a great Monday.